Today I'm here to answer some Q&As about composite bonding. As a patient, you can keep your bonding fresh by using an electric toothbrush, always using flossing as well, and perhaps a little bit of mouthwash, one that doesn't stain too much, avoiding coffee 3, 4, 5 times a day, which I'm guilty of myself. Avoiding smoking is also a really big benefit for keeping the composite looking fresh and clean. Composite bonding can last anywhere between 3 and 10 years. It very much depends on how well the patient takes care of it, such as coming in for routine maintenance, polishing, hygienist appointments, and also how stain heavy their diet is. If you have a relatively stain-free diet, these things can last a very, very long time without needing replaced. Every 6 months, I'll usually get my patients back and we'll do a general clean, polish, a little bit of airflow stain removal, and then we'll use the polishing discs that we used to finish the composite. We'll use that again to maintain the composite, keeping it shiny and fresh. I'm Dr. Rory, and welcome to the Dental Studio.